This episode of the Ortho Show is brought to you by Veradigm. Some healthcare technology companies deliver clinical data for biopharma and health plans. Some help turn that data into insights. Others serve healthcare providers directly by providing point-of-care clinical software. Only Veradigm does it all. That unique combination added to our nationwide scale is why so many leading healthcare companies choose to be a part of the Veradigm network, working together with Veradigm to transform healthcare insightfully. Whether you're a healthcare provider, patient, biopharma company, or payer, check out www.veradigm.com. That's www.veardigm.com to learn how Veradigm can help you too. It never ceases to amaze me the uniqueness of our guests on the Ortho Show. We have Alexis Dixon on, who's an orthopedic surgeon, who's a foot and ankle specialist, who decided to set up solo private practice in Marina Del Rey. God bless her. What a smart idea. It's one of the most beautiful places on the planet. And then she really got into this thing. She sort of ventured into the medical legal space, and she found that it could be quite lucrative to become a qualified medical evaluator. From that, she sort of became this sort of independent workers' comp type of physician. And I really love her story. And from there, it grew into a business. And now she has an incredibly successful business in that space where she's helping other doctors identify ways to become this qualified medical examiner, as well as incorporating people for legal defense as well. So really fascinating story for a young woman, entrepreneur, orthopedic surgeon that we're really happy to share. Dr. Scott Sigman, hashtag follow the fro.
From Medical Media, this is The Ortho Show.
Hello world, Dr. Scott Sigman, your favorite opioid-sparing orthopedic surgeon here for another episode of the Ortho Show podcast, where everyone knows we bring the best of the best in orthopedics. We are going West Coast today. We're bringing on Dr. Alexis Dixon, who's an orthopedic surgeon that specializes in foot and ankle surgery. She's in solo private practice in Marina Del Rey. Very cool, not something that happens very often. Team physician for Red Bull North America, a lot of crazy stuff going on there, I'm sure. Consultant for the Las Vegas Raiders and founder and CEO of Ortho Legal. Alexis, what a pleasure it is to have you on the show.
Thank you for having me.
I'm like, for those of our listeners, you should be watching this now on YouTube because Alexis has the most gorgeous office. I'm looking at Marina Del Rey. I'm jealous from my days at Curl and Job and how I used to go with my rollerblades across the back area there, but what a great spot for you. So listen, we always start at the beginning. We like to know, where you were born, is there a family that were doctors? What made you decide to get this crazy idea about being an orthopedic surgeon?
Yeah, absolutely. I'm one of those people for whom being a doctor is a disease that runs in the family. My dad is an orthopedic surgeon. My mom is an ER nurse. They met on her second day of work and his first day of intern year at UCI Medical Center. I have a sister who is an anesthesiologist as well. And so, yeah, I've been surrounded by doctors forever. I tried to do anything but go into medicine, and I was an art and Spanish literature major throughout college and became a pre-med as a senior.
So I love that story. You were probably conceived in the hospital. I mean, I don't know if we have confirmation of that, but that whole doctor nurse thing and the whole wash closet, who knows how it all plays out. But
I haven't investigated that.
Yeah, we'll leave that alone. It's all good. But I think that's fantastic. So are you a Southern California girl, or where were you born?
I was born in Southern California. We moved when I was 10 to Maui, where my dad worked as a orthopedic surgeon at Kaiser. And I came back out to California for my undergraduate degree. I went to Pomona College and then stayed on for medical school and residency at USC.
And I'm sure you're an outstanding surfer, shortboard, longboard, the whole thing, right?
The best, just the best.
Course, right? I mean, you grow up on Hawaii, but that's just like, that's second nature. That's what you do. I love it.
Everyone surfs a little bit, and so that's where I fall. I surf a little bit.
You surf a little bit. Okay, great. My oldest is in San Diego. He's all about surfing and tacos, and that's like his life. But no, I love it. So Pomona, and then you stuck around. So Pomona for college, and then USC for medical school, where we'll throw out a little love here as the valedictorian, which is fantastic. Congratulations for that.
Thank you.
And so tell us about that experience. How was the medical school?
I mean, USC was a fantastic medical school. I had actually spent a year on the East Coast as I applied to medical schools, and the only school I applied to in California was USC. And I came out in December during a blizzard, of course, classic story. And I said, I got to get back out to California. It was my number one choice. I was really excited to get into USC, and I loved the education there. We were seeing patients within the first 2 weeks of school, and very integral in the community with the LA County Hospital, which so many people have trained at. I believe I heard that 2/3 of all physicians in Southern California did some part of their training at the LA County Hospital.
Yeah, no, that's awesome. And you made the crazy decision to stay for the orthopedic residency at USC, which, that's an arduous residency. It's not easy. There's a lot of trauma going on there and a lot of stuff. So tell us about that as well.
Yeah, I fell in love with the trauma department there. I loved orthopedic surgery. I considered other surgical subspecialties as well. And it was a massive residency program. We had 10 residents per year. And my first day in the OR on orthopedic surgery, we were fixing an ankle fracture. And the fourth year resident handed me a drill and let me put in some fibular screws. And it was just fantastic. And there was no looking back after that.
I love it. And that father-daughter orthopedic surgeon combination, we do experience that on the Ortho Show on occasion. I'm going to send out some love to my dear friend Michael Redler and his daughter Lauren Redler, who's a pediatric sports medicine specialist at Columbia. And we've got a lot of father-sons in there too. So what a great sign of love and respect. And when you sort of fall into the same category and do the same thing. And so foot and ankle, right? I mean, so you decide you're going to finally leave Southern California. You're going to head out to Baylor, where you're going to do a foot and ankle fellowship. And what was the draw for foot and ankle for you in particular? Because it's not that common of a subspecialty.
It's not, but at USC, it always has been. Um, Dave Thorderson was our residency director, and he made it look like just the coolest specialty that you could imagine. We enjoyed our cases. They were quick, they were outpatient. There was a lot of benefits to it, but they were also just really fun. And I really enjoyed my colleagues. It seemed like the Foot and Ankle Society was where I kind of found my people, and that says a lot about me. It's a pretty nerdy group, but I really enjoyed the camaraderie and the sense of community within foot and ankle. Here in LA, we have a quarterly meeting of all of the foot and ankle surgeons in town, and people really do go out of their way to make it. I've been going since I was a medical student, and it's a fantastic community. And I didn't really have exposure to a community like that in any of the other subspecialties that we went through, but I just really felt at home with foot and ankle.
That's interesting because also, you have an entrepreneurial spirit, and there are very few doctors that leave, fellowship and decide to set up a solo private practice, right? That's a unique stage. But I think that having a foot and ankle specialty allows you to do that because there's not nearly as many foot and ankle specialists as there are. You trip across all the sports medicine specialists in LA County, right? And so I think that's quite interesting. I gotta give a shout out to one of our favorite Ortho Show alumni, who is Lou Schoen, foot and ankle specialist out of Baltimore. I'm going to ask you if you had the opportunity to be on the stage with any bands or any concerts like Lou was with, or no, not
Not
that.
yet, but I have asked some patients for an invite now. Now that I saw that it's possible,
Yes.
I do have some patients that I've hit up for that, and they claim that they're going to invite me, but we shall see.
Well, you are in the land of celebrity and rock and roll out there for sure. So I'm sure many of your patients are involved in industry, the film as well as music industry out there as well. So tell us, I mean, it had to be pretty daunting to decide to open up a solo private practice, right? You're going to have to take out loans. You're going to have to figure out a lot of the business side of medicine on your own.
Absolutely. And I had a bit of a leg up with the surgery center that I worked with that was able to provide a small income guarantee to get me on my feet, but I very quickly went completely independent. And I've seen a lot. I didn't know much about private practice when I started because obviously at county, we never handled any kind of billing. So it was all very new to me. And this is where my father wasn't even able to help me out very much because he had been at Kaiser, which has a completely different system as well. So private practice is something that I wasn't even sure was really around anymore or would be feasible today because I'd been told that it's a dying classification of practices. And it is possible to continue to do private practice and solo private practice in Los Angeles. I'm really fortunate that here that is a possibility. It may not be true everywhere, but I want it to be. I really am in support of solo private practice. I think that by doing this, I'm able to practice ethically and practice the kind of medicine that I like to practice. But I did have a lot of painful lessons along the way.
When did you start making some money? I mean, you had to pay the bills, right? I mean, like you're not making a lot of money the first year because you got a lot of stuff you got to pay off.
Right, and I was certainly working 7 days a week.
Yeah.
I was moonlighting, I was, volunteering, I was assisting my colleagues in the surgery center, anything I could do. I've heard it be titled the West Side Hustle when you're here in LA trying to make it work. That was Eric Giza told me that that's how he felt that it was, when he was in Los Angeles. You just had to find all kinds of work, different ancillary income streams, anything you could do to try to support the practice. And then once the practice is supporting itself, you can start to shed those. But for the start, yeah, everyone in private practice is taking any work that they can get. There's a good network of people in private practice, and we had a lot of events and dinners, and you would just go out and meet people. I personally went to the Century City Medical Towers and dropped off my business card at every single office in the towers every quarter for the first couple of years.
Amazing. So Rona Parsa is a Ortho Show alumni as well. She's in down in Manhattan Beach area. I'm sure you guys are, have commiserated in the past as she set up a very similar solo private practice as well, and she's doing terrific now as well. So I mean, it's a true success story, but it's hard work, right? It's not something that's given to you, and most people just want to sign a contract, guaranteed salary. You're going to take some call, but everybody else takes care of all the business stuff. And so that's a great segue, as to, why you decided to then move even further into orthopreneurship and starting up your own business. But I just want to sort of review a couple things before we get started. So again, my mother Judy's always listening, so we have to explain stuff so that she can understand it. And so, I read your CV, and I thought I was kind of humorous and with only respect, but on your CV, it says that you've done 2,700 medical reports and 76 court appearances and depositions. And the vast majority of orthopedic surgeons would be proud to say that they've done none. And they certainly don't want to list it on their CV. They want to stay out of the courtroom and they don't want to do any depositions. So it almost reads more like, an attorney's CV in some ways. But tell us a little bit about what a qualified medical evaluator is, and then we'll talk a little bit more about the business model.
Absolutely. About 5 or 6 years ago, a colleague also in private practice who had just kind of hung a shingle in LA told me that the way forward was to find ancillary income and to find ancillary income that would actually really pay the bills, not just spending 12 hours moonlighting, but to actually be doing some legal work. What a QME is a neutral party for the state of California in contested workers' compensation cases. So if an injured worker has a dispute with their employer, the state of California becomes involved and appoints a physician to be a neutral expert witness in those cases. And it all completely stays out of the courtroom. It's largely testimony through reports and report writing. And you don't have to pick one side or the other, or they don't pick you. You're a neutral party. So you get to practice very ethically with this. And you're just trying to seek the truth. And the great thing about that in the state of California is that this is very well compensated. And currently 1 in 4 orthopedic surgeons in California does the work. About 3/4 of these cases are musculoskeletal in nature. So I would argue that this is actually orthopedic work.
No, I love it. And so for our listeners, as a physician that does workers' compensation, surgery and taking care of these patients, I have an opinion. And then what happens is that, as a general rule in Massachusetts, when they don't like my opinion, the workers' comp then sends out for an independent medical exam to someone that's paid for by the workers' comp people, who gives the exact opposite opinion. And then this patient's in limbo and really not really able to get back to work, or maybe having a disability, or desire, or should have some sort of compensation package. So I think it's fascinating that California has this. I don't believe we do in Massachusetts. I could be speaking out of hand. We'll have to do a little research on that, but I think that's interesting. And then, and again, if it's lucrative, it's time well spent. And I really liked your commentary, which is you're trying to find the truth. And when you're not the care physician, you're not primary care for the patient, but you're not for opposing counsel, and you can be objective and find that truth. That's really pretty cool.
Yeah, it does help to settle the cases, move the case along. It's a really important part of the workers' compensation in California, which is a massive system, obviously, with our population and the number of injured workers that we have here.
All right, so I can see now where the business model's coming in, right? Here you are, you're a busy orthopedic surgeon. I'm sure there's a very specific system in place to be a qualified, medical, I want to make sure I get this right, evaluator in California. I'm sure there's forms that have to be done. There's a system in place that needs to be done. And most of those doctors are like, well, maybe I'll do it, but it sounds like it's arduous and I'm not going to know how to do it. And then I'm thinking ortho legal is going to help out in that process.
Absolutely. I started doing the work myself before founding Ortho Legal. I've been doing QME work for 5 or 6 years now, and it allowed me to stop moonlighting every weekend. I was able to spend a day a week seeing and evaluating injured workers and working on the reports. But it was a very finite amount of time I needed to spend on that. Doesn't keep you up at night. You're not thinking about these cases the way that you do if you're in the OR with them. They're not your patients. You're just helping them to get their financial settlement and to get the treatment that they need. So it's not stressful work. But there is a procedure that you have to take an exam and take a course through the state of California to become a QME, which is a bit of a process. And our company does help people through that. Now, Ortho Legal has only been in existence for 3 years now. So 3 years ago, I was the only doctor working with the company. I went independent. I previously worked with a different management company, but I was frustrated with the inefficiencies. And I personally feel that physicians should be running more of medicine. My personal belief is that an orthopedic surgeon doing the work is going to be able to create a better company than an investor backed model. And so I built Ortho Legal after my own QME practice, and I know it forwards and backwards and the entire flow. So about 2 years ago, we started welcoming in other orthopedic surgeons and a few pain management physicians as well to start working with the company. And we now have 63 physicians working with us.
All right. So, for those that know me, I'm the chief medical officer and founder of Ortho Laser, Orthopedic Laser Center. So I know all about, entrepreneurship. We have 20 centers open. We just hired a new CEO and finished our capital raise. We're going out for significant expansion as we move forwards. It's not easy running a business, right? I mean, it's hard enough, figuring out the right surgical intervention for someone that has ankle arthritis, much less running your solo practice and now running a business where you have 64 physicians that are, part of what you're doing. So talk to us about how you manage that. I mean, that's a lot of responsibility.
It is a lot of responsibility. And the fact is, since I still have a clinical practice and since I still do the QME work, I do know it forwards and backwards. What we've built here in Marina Del Rey, we are hiring excellent staff. We're hiring recent college graduates, most of whom are also pre-medical or pre-ortho even. A lot of them just took their MCAT. So we have a really bright team that's helping to put things together. And I am highly, highly organized. And so while it is logistically challenging, I have shifted my focus onto this for now. I started this during the pandemic when an elective foot and ankle practice was really not demanding a lot of my time. So I was able to make a bit of a shift of my attention.
Do you have an executive leadership team that helps you on the business decisions, or are you just the CEO and running the whole thing?
Yeah. I have some friends and mentors that I'm able to bounce things off of, but essentially it's I'm CEO, COO, CFO, all of the above.
That's a lot of C's and a lot of O's, but
Yeah.
I get it. But as you're expanding, I mean, obviously, that model, you may want to consider bringing on some people that can sort of manage the day to day for you. And I'm assuming, you provide all of these services, and then there's a fee that these physicians, sort of you take off the top in order to help manage this and provide them counsel in the process of being able to fill out the forms and do their job.
Absolutely. There's a lot of administrative tasks that come along with this work. So we do everything that we can to alleviate any of the non-orthopedic work. For instance, we can have a historian call and get the medical history in advance. We can take a stack of medical records and have it transcribed into a Word document. And we can provide quality assurance and editing for the reports to make sure that our physicians are not only well trained, but also in compliance with all of the current law and case reports. And so these services, in addition to all of the real estate and the staffing, are they're massive. It's a lot of infrastructure that we provide, but we also do the billing and collections. So we're able to just collect our fee, and we pay out the physicians the following month after their income is collected.
Yeah, you're going to need some help. I'm telling you right now, you're getting busier by the minute. We met when we were just strolling through. Was it the Academy? I can't remember where it was. Maybe it was the Academy. My
It
dear
was.
friend, Amin Modaber, who I'm sure you know as well, who's a hand surgeon in Santa Monica. Uh, we were very impressed because he does some of this work. And now, again, you're like moving into the courtroom here, because you're not just doing QME, but you're also providing, medical legal expert witness work as well, both plaintiff and defense. So defendant. So tell us a little bit about how you're expanding into that role as well.
Yeah, absolutely. QME work is certainly our bread and butter, and it's what people are able to rely on for a steady income. You have pretty predictable volume if you do QME work, but personal injury work is typically more money for less work. The cases, the reports in any case are simpler. There may be tighter deadlines, and you do have to be on one side or the other, but we're able to get people connected with the attorneys who need expert witnesses. It's really a tough market to break into, and so it's really helpful to have a management company who's able to advertise you to the attorneys. For instance, last week I was at an attorney conference. I go to about a conference a month now. Some of them are orthopedic, like California Orthopedic Association, Western Ortho Academy, but there's also conferences and conventions for all the different attorney groups, whether they're workers' compensation or not.
I forgot I did see you at COA as well. I was presenting there, and I think that's when we finalized the introduction to make sure we bring you on the show. It's fascinating. I mean, it's an area of medicine that I have really sort of stayed away from, honestly. I felt like I was compelled to sort of stay and focus and be an expert in what I'm doing there. But you truly, you can sort of crossbreed between those two, cross pollination, and then you can be a leader, which is what it takes as an entrepreneur to be able to expand your business, to be able to provide what's necessary for people to be successful around you. But listen, I hope you're not flying the planes as much as you used to, because on your CV it also says that you're a student pilot, and you need hours to fly a plane. So please tell me you're not flying that much right now. You seem busy.
I'm not flying as much as I used to. I do still go up there every chance I get, but it's not as much as I was able to do a couple of years ago.
Yeah, I'm sure. And they say doctors are the worst pilots, right? Because they feel like they can always get themselves out of situations. So please be careful, for sure.
Absolutely.
And the Santa Monica Airport was one of my favorite places to go. I don't know if there was a Chinese restaurant there that we could always go to and watch the planes take on and off. That was kind of
Yeah.
cool. No, listen, I think that, this is fantastic, Alexis. I mean, you truly have carved out a very, unique niche for yourself. And I think that it's probably only going to grow as your reputation grows. And I hope that you're going to continue to do some foot and ankle surgery and maintain, that expertise as well, because I think that gives you legitimacy within your other aspects of your business model as well.
Yeah, absolutely. I don't intend for my private practice to go anywhere. It's literally across the hallway from here. My surgery center is downstairs from here. It's all in the same building, and I live half a mile away. My life is very efficient, but even if there's an ankle sprain that wants to see me today, I can run across the hall and see them.
Thank God you live a half a mile away, right? That is the one thing you got to learn in Los Angeles. If you live there, you got to be close to where you work, because those commutes are miserable. So listen, I'm writing a book, Physician Brand RX, and so what I like to do now is I like to, at the end of the show, sort of give a summary of the brands that our guests, have really created. And you have some very unique, branding that I can't say that I've honestly see very much. First and foremost, clinical surgeon, fantastic. That's what we all do. But your entrepreneurial spirit is terrific as a solo practitioner, as well as now starting with the legal, and who knows where you go from there. And a legal expert, right? We haven't had a lot of legal experts. And so do you spend, time on social media being able to promote? How do you get the word out other than going to conferences, et cetera, about these opportunities that are available for your business model?
Yeah, I'm fairly active on LinkedIn. We have a physician liaison, and she and I together put out an article every week. It may be a current events article about a new on-bank decision from the Division of Workers' Compensation, or it may be just common questions that people have, summaries of case law, things like this. So if you follow our LinkedIn, we have that. Every week we have an update, and I post pretty regularly on that. I don't think that my work is super amenable to Instagram or to Facebook and that sort of thing. So we are mostly on LinkedIn.
Yeah, I think that makes sense because your end user is really physicians at this point, and then the connections are the people on the other side, but they're also professional connections. You can certainly do Facebook, Instagram for your foot and ankle practice if you were, trying to sort of market yourself that way. We're going to interview you for the book. I'm going to have Matthew Ray Scott reach out to you, and we'd love to sort of get your perspective. And I guess the last question I got to ask you is, when are you going to law school?
Oh my goodness, I would never. It's completely unnecessary. And like I was saying, this is orthopedic work. I truly predict that in 10 to 15 years, at least depending on what state you're practicing in, this is going to be a normal part of an orthopedic practice. Clinical reimbursements are declining, and there's only so much call you can take as they continue to decline in reimbursements. And so you're going to have to find some non-clinical work to do. And so I think this is going to become more and more common.
You're speaking the gospel to me. It's time to work smarter, not harder. We're a high volume practice at this point, and you got to look for other ways in order to get home and spend time with family for sure. Well, look, Alexis, this is fantastic. What a unique perspective for an orthopedic surgeon to be able to share the unique things that you're doing within the workers' comp space, as well as within the medical legal space as well. And of course, as an accomplished orthopedic surgeon that specializes in foot and ankle. What a pleasure it has been to have you on the show.
Thank you so much. It's been a pleasure.
We wish you the best of luck with Ortho Legal. This is Dr. Scott Sigman, #FollowThePro, host of The Ortho Show. Till next time.